Well, good morning, everybody, and welcome to the UK Spine Conference 2021. I'm so pleased that we've finally got to this point. An awful lot of planning has gone on, and I'm pleased that you're finally here for an amazing 3-day conference where we look at all of the many ways in which the UK Spine has been addressing these challenges, and I'm hoping that we'll have a lot of opportunities for networking, sharing between each other, further opportunities to grow the activity of the spine. So who am I? My name is Clare. I'm Deputy Director for Research Services here at Oxford, and I'm also a member of the Spine Steering Group. And so I'm very proud of what we've achieved. I'm very honoured to be invited to open the conference today. So I am going to talk through a few slides just to explain about the spine, what our aims are, what we've achieved, as a lead off into the conference itself. So let's see how my screen sharing is going. I think that's worked. So the title of the conference, we're talking about the Age of Healthspan. Why are we calling it this? We're calling it this as I move the slides on, because this is the fundamental challenge that the spine is here to address. These will be familiar to most of you, but I think it's worth me just starting from the beginning once again. So we know that lifespan is increasing. The medical advances over the last decades have meant that we're all living longer. Life expectancy is increasing, but despite that, health span is lagging behind. And so the number of healthy years that we have in our lives is not matching the number of years that we have in our lives. We know that this has tremendous socioeconomic consequences. We know that it creates a financial burden on society, and it makes life unpleasant for many of us. We know that the government's goal is that we should be aiming to add an extra 5 years of healthy life by 2025. This is something that we all have a vested interest in, and this is a goal that the spine shares. So the answers to the challenge are out there. They're just not connected up. We know that these potential solutions are there, but inside a number of institutions, companies, universities, other organisations, hospitals, patient groups, and these things are not always the information doesn't always freely flow between these different organisations. So the job that we've set ourselves is to help this exchange of knowledge. Ideally, we want frictionless knowledge exchange. Now, obviously, we know that friction-free activity is not strictly possible, but we want to reduce that friction as much as we possibly can. And so for those of you in universities who are familiar with the knowledge exchange framework, you'll recognise here some of the different aspects of that framework. In order for us to really have a good exchange of ideas across the boundaries of those institutions, we need to think about all of these things very carefully. We need to think about how research partnerships work. We need to think about different ways of managing intellectual property and making sure that things are properly commercialised and reach the market. We need universities working closely with businesses working closely with universities. We also need to make sure that the right skills are in place. We need the right levels of entrepreneurship in people's behaviours so that we can bring these things to the market. We need to make sure that the private sector and universities are working closely with the public sector and the third sector. There are many different organisations who are committed to delivering answers to these challenges. We just need to make sure that the exchange of knowledge and the exchange of activity between is frictionless and properly joined up. And it's not just about the specialists either. We've all got an interest in this, and this is about making sure that public and patients are engaged and involved in the discussion. This is not just a conversation between rarefied pockets of expertise. This is a conversation that we all need to be part of. And so how have we built the spine? Well, the beginning of this project has been core partners, 3 universities, the Crick Institute and the Medicines Discovery Catapult. You can see them as the red dots on the screen. This is where we started a few years ago, but it was always something that we wanted to expand. The ambition is to build a big network across the country and around the world, which brings together people who care and are committed to solving these challenges. So far, we've recruited a number of additional academic partners to the program, and you can see them here on the screen. And we're very pleased to see that the number of projects we're investing in and the number of partners that we're working with is expanding. These are just the academic partners. There are a bunch of other players and organisations that you'll hear from over the coming days. And of course, they still allow us to maintain the image of the spine, although that's not a restrictive geography. If you're an institution that doesn't happen to be in that particular geography, please do still get in touch and still feel part of us. So how is it that we're moved on to quickly? How is it that we're proposing to do this joining up and generate this frictionless KE? So what we don't want to do is put barriers in the way of these exchanges. What we do want to do is use the existing resources. So all of these institutions have got knowledge exchange professionals employed by them to help this kind of activity. Business engagement people in universities, technology transfer offices, research services offices, university liaison offices in companies. And what we don't want to do is reinvent the wheel by hiring a whole new or creating a whole new function within the spine. Instead, the philosophy is that within each of these institutions and organisations, the spine will work with existing partners and expertise to draw them into the common endeavour. Of course, in order to facilitate this, one thing that we don't want to be doing is spending a lot of time negotiating contracts. So the core partners and the growing members of the spine are signing up to our framework agreement, where we're very conscious that contracts can sometimes act as barriers to the sharing of information, through confidentiality or through caution. And we wanted to make sure that actually we had an agreement which promoted the sharing of information between partners. Of course, there need to be mechanisms for identifying IP, for protecting IP, and for developing strategies for bringing intellectual property and ideas to the marketplace. And we've addressed that within the agreement, but we don't want it to be in closed boxes. We want it to be something that we do collectively and together. And also mindful of the comments I was making before about engaging everybody, we want to promote the dissemination of knowledge. We don't want knowledge locked up on the shelf. We want things to be promoted, including negative results. And we want this to be a philosophy where we're sharing amongst ourselves and with partners and with the public as much as possible in order to deliver this frictionless knowledge exchange. So what I'm going to do now is talk a bit about some of the projects. So in the spine, we've had funding, and I should acknowledge the funding from Research England, which is driving this project, without which it just wouldn't have been possible. And that is allowing us to fund these projects, 28 and counting. I think it's more than that in terms of kind of sub-projects and other activities, but these are the key things that we're doing. Different sorts of projects, some large flagship projects driving some of our key activities, bridging projects and proof of concept projects looking at starting things off, and some knowledge exchange projects looking at improving the KE mechanisms that we're building into this, building into the spine through this frictionless KE philosophy. So I'm just going to pick up on three very briefly, and talk through some of the things that we're doing here. So the porous drug discovery pipeline is kind of the epitome of what we're trying to achieve. In order to get from early stage research to clinical therapeutics, the challenges of that have been endlessly discussed in many conferences for many years. It's very complicated and difficult, and we're conscious that even within the spine partners, all of that expertise is not in the same place. Different institutions have got resources, capabilities, and people that are good at different things. And so, at the heart of this project is making sure that there's a collaboration on a porous pipeline from beginning to end. So, Oxford will do what Oxford is good at, Dundee will do what Dundee is good at, and then we'll hand over seamlessly to Birmingham so they can do what they're good at, working with the CRIC to bring their expertise, the Medicines Discovery Catapult to engage with their partners, and to make sure that everybody's engaged in a single endeavour across a number of institutions. It's the job of the team, the Spine Knowledge Exchange professionals who are embedded in all of those institutions to make this a slick process. Why porous? Partly that's about the seamless interchange of knowledge between the partners, but also we want this to be something that other partners can join along the process in different ways, and therefore we want to make it easy for people to access this activity and bring other partners into this project. All of these projects I'm talking about, by the way, will be part of the discussions later in the conference. And if you've got any questions, you can go and meet the KE team at their expo stand, and they will direct you to whoever you need to talk to. So the second project I'm just going to pick up on is one of our proof of concept projects. This one is led by the Medicines Discovery Catapult. We know that an awful lot of approved drugs out there which potentially could be used for addressing elderly and multi-morbid diseases and challenges, but how do you find them? This is a platform. It's a needle selecting platform in the haystack of possibilities that will enable people who are looking for potential drug candidates for conditions that they're looking at to quickly gain access to an awful lot of information about those possible candidates. And again, this is something which we'll be able to delve into in more depth throughout the course of the next few days. Finally, just to illustrate that we understand that not all the good ideas happen in universities, this is a collaboration between academia and some external colleagues looking at how do you enable philanthropists to support clinical trials. There are committed people out there who are not part of the usual suspects of medical charities or government funders who would like to get involved in funding clinical trials. But this raises potential governance and ethical questions that will need to be addressed in order to make this happen. So this is a project just looking at building an ethical framework that will enhance the ability of philanthropists to engage in supporting clinical trials, and will hopefully lead to more funding and more engagement in this area. So what I've done there is had a quick rattle through why we're here, what the philosophy is, some of the projects that we're running, and we're very proud that some of the things that we've set out to do, many of the things we've set out to do, we've achieved. We've convened this network of highly skilled experts from within the field of aging research around the UK, and we've reached out to colleagues outside the UK as well, because these are global challenges, that we're not the only country that has to face this. We've built platforms, we're curating platforms, and we're reaching out to other people with platforms that will increase data sharing, that will increase the unlocking of knowledge in these boxes, so that those solutions that are out there can be connected, and then we can move towards developing better drugs, drugs that will access more than one disease, that will help give us these extra years of health span. And we're very pleased to have funded through Research England's support high impact projects that have moved forward the field of geroscience in different areas, and convene partners who are going to work together, continue to work together to, I think, build on the start that we've made. Although we've achieved a great deal, we've funded a lot of activity, and many of these projects have been very successful. It's just a good start. The challenge is enormous. And so we're very pleased that you're here today, either as part of our network or because you're about to join our network. And we hope that this is the beginning of many years of positive working together over the time to come. So that's it from me. Thank you very much for your attention. I really hope that you will enjoy the next 3 days, that you will continue to engage with colleagues in the UK Spine. Do ask questions of them, meet the team at the Expo booth, come and have a look at the work that's going on, and do stay in touch with us. What I've got on the screen there, obviously, is our web address and contact email, but also you'll find us on Twitter and YouTube. So thank you very much for listening. Welcome, and I hope that you enjoy the next few days. Thank you very much.